Thank you. It is a treat to be here. And I need to start by saying that there's one thing I love to do, and that is celebrate. Not only in parties, because I love to party and have fun, but I love to celebrate. I love to fall in love with people. I love to find their strengths. I love to marvel at them. I love to hear their stories. I love to acknowledge them, and I love to be inspired by them. And when Marilyn and I were talking about the awards, and she was just mentioning and saddened by the fact that there were awards that people weren't nominated for them this year. And I just need to start by just putting in a plug for celebrating. It doesn't matter who gets the award. It matters that we celebrate one another. And you can fill out 5 awards, and you can nominate 5 people. And you know, if they're all great, you know what they just do? They'll just put them in a hat and pull out one. It's not about somebody being excellenter than another. It's about all of us doing great work. So that's my piece about celebrating. And while we celebrate, I just have to, I know I'm here for the Frances Montgomery Award, but I think I need to celebrate Ted Murray, because without Ted Murray, we wouldn't be here either. So Ted, you can stand up. He's my good-looking husband. He's the reason we do what we do. And there's somebody else who's also the reason that we do what we do. So I would like to introduce the person that this award is named after. So this award is called the Frances Montgomery Compassionate Community Caregiver Award, named after my dear, fabulous, incredible aunt. To acknowledge her, to tribute her, to thank her, and to honor her. This morning, Michelle talked about cure being the same as change, or being equaling it with change. And she talked, and I thought about my aunt who transformed my life and helped me. So let me just read a little bit about her. Frances, also known as Frankie, and if you're a politician, and your last name is Harper, then you would call her Cranky Frankie. But some of us call her Cranky Frankie, and on most good days, her name is Frankie. And I think I'm supposed to forward this. Yeah. There she is. And that's when she was in Nicaragua at Monte Surf Camp a few years ago. Her son started a humanitarian project down there. And this is her just the other day, kicking up her heels at Mill Bay. She lives in the Cowichan Valley and has been a fan of Cowichan and a starter of Cowichan Hospice years ago. Frankie's a retired nurse. She cared for her parents, in-laws, husband, extended family, friends, and community members for over 7 decades. At 89 years of age, she continues to respond to provide care for friends and those in her neighborhood, some of the old folks who are in their 60s. When I was 11 years old, I moved in with her for 6 months, and I stayed for 6 years. Careful where you invite me. She cared for me when I needed care. She is the epitome. She is the epitome of compassionate caregivers. I often say, thank you, I often say I came to hospice nursing as a child. It was Frankie who introduced me to Care for the Dying. She taught me about community, casseroles, custards, and caregiving. With her as my mentor, I learned about dying, care of the dying, care of the body after death. And watching her, I knew that care of the sick and the dying is everyone's responsibility. When her husband was diagnosed and dying with cancer, she cared for him while she raised 2 children, completed a nurse refresher course, returned to nursing, ran a 10-acre farm. Jimmy suffered excruciating, severe pain in the last months of his life. A nerve block was finally offered, and he died the next day. A few years later, we cared for my father in his last days. He died in my arms, struggling to breathe. We did not know about atropine or glycopyrrolate. These difficult deaths and the leadership and mentorship from my aunt gave birth to my passion for excellent care of the dying and excellent education and resources to help nurses, healthcare assistants, also known as personal support workers, and many other titles, but they are the salt of our team. They are the gems. And family members feel more comfortable and be more confident and competent in providing care for the dying person and the family. Her leadership and her expectations helped me to have the courage to pursue these projects. Frankie is unable to be here today because she's celebrating a friend's 100th birthday with him down in Kit somewhere. Her expectations led to our development of Life and Death Matters. Ted and I created this award to honor Frankie and to honor other caregivers like Frankie who reach out and on a daily basis extend their circle of care. We had anticipated that this award would go to an individual, perhaps a hairstylist, perhaps a taxi driver, perhaps a mechanic, or maybe a volunteer, maybe a friend, or maybe a neighbor. But this award this year goes to a community of caregivers. How appropriate. And I got to tell you, when Frankie heard the story about and read the nomination letter to her, she was thrilled. And she said, well, the money that you're donating isn't enough. And she topped it up and added $1,000. So next year, if you nominate someone, make sure you give them a letter of really good money. So I would now like to introduce the family and the caregivers. This family, Frank, is the elder who was living in a small, remote community of Lac Balam, a remote coastal village north of Prince Rupert and just south of the Alaska Panhandle. You get to the village by going to Prince Rupert, which means you just go to Prince George if you're driving, and then take a short little jaunt, only 10 hours, over to Prince Rupert. Then you wait for the ferry, you get on the ferry for 45 minutes, and then you drive for another 20 or 30 minutes, now that the road's paved. It used to take 45 minutes or an hour to get to the little community of Lac Balam. Frank was from this community, and when he was diagnosed, sorry, this is the picture of the community. Let me just do this first. So here's the ferry. I said to Frankie, I think we should go to Lac Balam to present the award. She thought that sounded like a good idea too. And then Frank's sister Connie said, no, my mom died a few days after taking the trip. So this is Frank. He had been diagnosed a while before, and I'm not going into any of his diagnosis or timeline. But at this point, this is his last exit from the hospital, and he wanted to go home to be cared for by his family. His siblings and nieces responded. It's not easy, as you know, to care for a loved one anywhere, but to respond to a sibling's wish to die at home in a small remote community is even more remarkable. The siblings worked together and reached out to the nurses for support. I love these photos. Wouldn't you just love to be there with them? So here's Frank, and I got to just tell you the story about Frank. See how he's wearing oxygen, or an oxygen tube, or whatever you call them, nasal prongs? But when he got home, he was really concerned about the hydro bill. So do you know what you do when you're concerned about the hydro bill, and you're concerned about your family paying the bill? He would turn the oxygen off, or turn it down low, because he was worried about the hydro bill. So when you think about the complexities of care, when I think about Frank and I think about the stories, the little bit of the glimpse I heard, I thought, if these guys can do this in Lac Balam, we can do this anywhere, if we can follow their leadership. So, in caring for Frank, there were nurses, but they weren't just nurses from Northern Health. A few of these nurses are from Northern Health, but one of the nurses is a home care nurse hired by the band. So we have now not only the geographic boundaries, not only the water and the small town and the remote stuff, but we also now have nurses who are hired by different people. So the nurses hired by the local band, or by the First Nation community. We also have the nurses in the clinic hired by the First Nation Health Authority. And we have a Northern Health nurse who's the palliative care symptom management, the palliative care nurse consultant, am I correct? Is that how you say the title? Yes. Good. So this is Sandra Stanley. And all of these nurses coordinated across the miles. So to get a bed to the community took a month of negotiating before the bed got there. I'm glad to say the oxygen, I hope it's quicker. To provide daily support, the home care nurse hired by the band collaborated with the clinic nurses hired by First Nations Health Authority to provide best coverage. The nurses collaborated, arranged visits, and coordinated schedules. To learn how to manage the symptoms, the nurses from the band and from the First Nation Health Authority communicated with the nurse from Northern Health via phone. And Sandra would send the PowerPoints in advance because the technology wasn't such that it worked for them to have a webinar. So Sandra would send the PowerPoints in advance, and then she would do education and talk with them about pain, about dyspnea, about the possibilities of hemorrhage. And she prepared them, and then the nurses took that information and they shared it with the family and with the home support workers. To access medications for symptom management, the band nurses and the clinic nurses communicated with the Northern Health Palliative Care nurse consultant and with the palliative care physicians, who lived 10 hours by drive, right, and ferry and car and all of that away, but they were willing to trust the assessment of these fabulous nurses who not only did the pain assessment and the dyspnea assessment, but they also did the safety assessment. So at a time in British Columbia's history when we are seeing an unprecedented number of deaths from fentanyl overdoses, can you imagine how the local locums and the local staff or the local physicians in Prince Rupert might have felt about ordering opioids? Not very comfortable. So as a result, thank goodness, the palliative care physicians ordered the opioids long distance. Not only that, they made themselves available 24/7. Wonderful, wonderful care. To ensure medications were available, the nurses needed to calculate the doses, how much they had, but not only how much they had in stock right now for the regular doses, but what if the symptoms increased? What if the person did hemorrhage, if Frank did hemorrhage, what would they need? They knew that there was no quick fix and that there was no pharmacy at the corner and no way to quickly access and no cheap way to even get the meds there. I want to tell you that Frank died at home a few days before Christmas. His sister Connie, with a few of the nieces, were with him. He was comfortable. His death was peaceful. His complex symptoms were well managed. Wow. After death, the family cared for Frank's body in the community. They observed the traditions and the ceremonies that were important to them and to Frank. They buried him on the little island burial ground where his mother and his father were buried years before. There was no disruption, no delay, no extra expenses, no waiting for the body to be returned from the funeral home or the hospital, or as Connie said, and we didn't have to worry that we were going to get somebody else's ashes. Today we honor and celebrate the exceptional work done by these compassionate, creative caregivers, working in extremely difficult circumstances every day to care for Frank and others like him. We acknowledge Billy Spence, Sharon Hurdle, Connie Henry, Henry Spence, Mary Henry, and Susan Dennis. We acknowledge the Lacroham band nurses, Pat Lewis and Susan Vickers, the First Nations health clinic nurses, and the rest of their team, Lacey Woloshin and Jessica Hardwick, the Lacroham home support workers, Dora Wellesley and Amy Sampson, the Northern Health Palliative Care physicians, Dr. Cam Gross, Dr. Carrie Clausen, Dr. Siobhan Keith, Dr. Invan Reddy, the Northern Health Palliative Care Nurse Consultant, Sandra Stanley, and the Northern Health Nurse Practitioner, Shirley Nixon. We acknowledge that Frank's team represents the many teams that you belong to. Frank's team today receives the award, but each of you are involved in teams, each of you struggle to collaborate, each of you try to do it within the shift, the hours that you're given, and each of you go beyond that and work beyond those hours. We'd like to ask Marlene Cooper, who is the Director of Nursing for First Nations Health Authority, and I think we should do it like they did the one earlier. If you come and stand here, then I get to crouch down and look cute right behind you. And Stacey Joyce, if you could come and represent Northern Health up here. And Barb McLean, are you here? She's getting ready to present. Is there anybody here who's a family caregiver? Is there anybody here who lives in a small remote community or is a First Nation person from a small community or big community? Well, If anybody else wants to represent the team, you just come on up. So once again, then to this wonderful group of caregivers, we give thanks and we tribute you. Thank you.